राईट सायडीन पेन जाता पुरो तकली आता 2-3 वर्सां जाली. कोणे म्हाका पयली डॉक्टरांक दाखयले. फर्स्ट म्हाका सांगले स्पायनल स्पॉन्डिलायटीस, मागीर ENT प्रॉब्लेम म्हणपा लागले. आणि हांव हालींच GMCन वचून येयले. सो तेणी म्हाका ENT डॉक्टरा कडेन. सो तेणी म्हाका सांगलेलो एक्सरे काड म्हणून. तो काडलो हांवें आणि कितें हार्ट कितें तरी वाडला म्हणून सांगलेले काना सकयल, रायट काना सकयल. सो तेका लागून ती नर्व प्रॉब्लेम दुखता म्हणपा लागले. ते पोक जाता आनी. सो आतां म्हणल्यार तेज्या उपरांत म्हाका टॅबलेट्स बी दिल्ले तेणी. म्हणल्यार ते थोडे तेप घेतल्या उपरांत बरें दिसलें, पण आतां स्टॉप जाल्या उपरांत परत कंटिन्युअस जालें. सो म्हाका विचारूंक जाय आसलें की आतां म्हाका न्यूरो सर्जना कडेन कितें दाखोवंक जाय आसलें बी काय म्हणून.
नाही, पण तुमकां हे हेडेक आसा पळय तेचे कंटिन्युअसली जाता काय थांबून म्हणजे थोडे 8 दिसांनी 15 दिसांनी अशें जाता?
ना, डेली जाता, पण थांबून जाता. आनी रातचे मातशें न्हिदपाक प्रॉब्लेम जाता. म्हणजे न्हीद बी पडना, दुखता. एका सायडीन न्हिदतले जावं दुसऱ्या सायडीन परत म्हणजे परतून बी न्हिदतले एका सायडीन जाल्यार दुखता अशें.
बरें, आनी एज कितें तुमची?
म्हाजी एज 25.
आनी काम कितें करता?
ना, सध्या घरानच आसा. एज्युकेशन कंप्लीट जालां, सो घरान आसा.
Any nausea, vomiting, photophobia?
तुमकां अशें जाता तेन्ना अशें उलटी आयल्या भशेन किंवा मळमळ्ळ्या भशेन किंवा उलटी येता अशें जाता?
ना, पण मातशें ब्रीथ.
सांगा.
It appears like a migraine headache because she is a young girl and it is a unilateral headache. And she says that earlier it used to be episodically, and now it is almost daily she is getting it. So it could be a transformed migraine kind of headache. I need to take a lot of history before I come to the conclusion that it's migraine, but it appears that it's migraine. Yeah, and migraine can be treated.
Yeah, that's most important.
Yes. So if she comes to us, then we'll be better able to evaluate her.
Correct. Okay, doctor, I think we have got a question. Hello.
डॉक्टर. वास्कोसून अजय उलयता.
अजय बाब, प्रश्न विचारात.
ते स्ट्रोक जावन ती मेमरी लॉस जाता पळय डॉक्टर, ती रिकवरी जाता काय ना? कित्याक म्हाजो एक नेंबर आहा पळय, तो 6 म्हयन्याचो अजुनूय रिकवर जावना. मेमरी येवंक ना. म्हणजे ती एज अबाव 65 आहा.
अबाव 65 आसा. आनी ताका कितें दुयेंस आशिल्लें? प्रेशराचे, डायबिटीज?
प्रेशर आसलें.
प्रेशर आशिल्लें. आनी स्ट्रोक जावन नक्की जालें कितें?
असो स्ट्रोक येवन म्हणजे तसो एक असो गट जालो आनी ताका एडमीट करचें पडलें.
नाही, म्हणजे ताची एक सायड पॅरलायज जाली काय अशें विचारता?
एकूच सायडीन.
मागीर ती आतां नॉर्मल जाली?
ना, ती अजून तशीच आहा.
Which side?
खंयची सायड?
Okay.
Okay, anyway.
Yeah.
His question was basically his memory will improve.
After stroke, the patient has lost memory, and whether he will improve or not is this question. See, in stroke, blood flow to the particular area of the brain stops at a certain time, and then it is an event that occurs at one moment, and then nothing happens. Gradually recovery occurs. But how much of recovery will occur, that will depend upon how much of brain tissue was lost.
So what is the extent of damage will decide what will...
If it is a small stroke, then the chances are that the recovery will be better. If the memory loss is profound at the onset, chances are that recovery will not be complete. But of course, recovery will occur with time.
Okay, so there is a ray of hope. Let's hope for the best. Doctor, we have got a question. Hello.
हांव श्वेता पेडणेकर उलयता पणजेच्यान.
श्वेता बाय, प्रश्न विचार.
नॉर्मल एक जनरल क्वेश्चन आशिल्लो.
विचारात.
म्हणजे अबाव एज ऑफ 60 ब्रेन्साचे जे नर्व्स आसा पळय ते वीक जाता.
इतकोच प्रश्न.
आनी म्हणजे अशें की हाय पीच आवाज आयकले की टेंडन्सी ऑफ ब्रेन म्हणजे अशें वीकनेस कितें अशें येता काय म्हणून, म्हणजे कंट्रोल जायना हियरिंग, वर्टिगोज.
म्हणजे वर्टिगो जावं शकता, पण हाय पीच म्हणजे आता तुमचे इंटरप्रिटेशन कशें आसा? म्हणजे कसले मशिनाचो आवाज, मनशाचो आवाज?
नॉर्मल लेवलाच्या वयर आसा.
अबाव 60 इयर्स म्हटले तुम्ही?
अबाव 60 इयर्स.
अच्छा. You got a question. She is asking whether means hearing to the loud voice triggered with means headache. She is above 60. She is basically asking, her question is whether weakness, with the weakness occurs in the brain nerves and all. That's what general.
With age, whether weakness occurs in the brain or the nerves. That is her question basically. See, with age, there is an atrophy in all the parts of the body. Of course, the brain undergoes some atrophy. The nerves are also degenerated, but not in a pathological manner. There is some physiological deterioration in all the functions of the body. So it's not necessary that every aging person will have a neurological or any other disease. It differs from individual to individual. And what she was talking about, that headache and that increased sensitivity to sounds. That can happen with age, because with age, of course, there is a you develop a sensory neural deafness in the nerves of the ears, and then that presbyacusis happens.
So basically, in fact, if you go to say, there is an answer in her question itself, because when she said that if she hears the loud sound, which can trigger, means whether it can trigger the headache. So, and she herself perhaps realizes that with that loud sound there is a triggered headache. So that means that's how the question must have originated. So, madam, तुम्ही सांगला त्याप्रमाणे तुमका व्हडलो आवाज ऐकल्यार असो त्रास जावं शकता. वयोमानाप्रमाणे खूपशे चेंजीस शरीरान जातात, तातले बरेचशे चेंजीस ब्रेनानूय जातात. ताची एक सडनली ऑल ऑफ अ सडन अशें जायना, पण ग्रेज्युअल जाता. शरीर ताका एडॅप्टूय करता, आयकपाचें काम कमी जाता, दिसपाची दृश्टी कमी जाता, अशे थोडेशे फिजिओलॉजिकल चेंजीस जातात. पण एकदम ग्रॉस अशें न्हय, पण जर अंडरलाईन दुयेंस आसा जाल्यार जावूं शकता. आय थिंक मॅडम वी हॅव गॉट अ क्वेश्चन. हॅलो.
हॅलो.
हां.
गुड इव्हनिंग डॉक्टर.
गुड इव्हनिंग.
सरला राजेश फ्रॉम मडगाव.
Sarla madam,
I want to ask you, the high blood pressure and high cholesterol is the only cause for this stroke?
No.
Or any other reason is also there?
Yeah, there are many risk factors for stroke. High blood pressure, high cholesterol, as you said. Diabetes is one of the very important risk factors. And smoking. Alcohol is that is a controversial thing. It is
you can be not frank. Just because in Goa you need not be so liberal. You can say if it is causing, you can say.
Yeah, no, but alcohol as such taken in moderation is said to be protective for stroke and not a risk factor.
So that is it. Because many people are waiting for this answer.
And if there is a family history of stroke, then the chances are there are 30% increased chances of having a stroke. So these are the major risk factors for stroke.
Okay. So doctor, I'll just add to this question. Is there any way, now suppose there is a family history, so as madam has already said that cholesterol is little high, blood pressure, how you can protect yourself under these circumstances, or maybe in general, like okay, these are the, if you go, like say what we generally go for morning walk, that, what you will advise to take care as for your brain and your sensations are to be kept intact?
See, this is called primary prevention of any disease. That before the disease comes, you have to take care of the risk factors. So all the risk factors that we talked about,
are to be under control.
Are to be under control. The blood pressure should be under control, under the guidance of a physician. Sugar should be under control. Cholesterol. So the diet should be taken care of. Of course, keep away from all the bad habits like smoking, alcohol as far as possible. Then there are other minor risk factors also, like sleep apnea. Leads to increased risk of stroke, like more snoring at night. Then one should consult the doctor and find out how that can be managed. Oral contraceptive pills, other drug addictions like cocaine and all, which might lead to. So all those things.
These are also minor contributing factors.
And of course, exercise. Exercise at least 5 days a week for about half an hour is a must to prevent stroke.
So let's hope everybody after watching this program will go for exercise. We have got a question. Hello. Hello. Hello.
Doctor, I'm Ravi Louis from Vasco.
Louis, Bab, prashna vichar.
Yeah. See, doctor, I have got spondylosis for the past 20 years.
What is your age?
I am now 49.
49 minus 20.
Yeah.
So started at the age of 30 years almost.
Do you prescribe me a operation for that?
Is it confirmed spondylosis?
Yeah, it is confirmed.
Okay, what is the level?
That level, I cannot tell you the level as such, but I was told that I have got spondylosis severe.
Neck or the back?
Kai, spondylosis kai asa tuka? Mane kasa, kamra kasa, fatigue? Mane kasa. And काम किरे करता तू?
I am a clerical job.
Okay, now I got a very important question for you. First, you answer this question. What are your problems? Forget that what is diagnosed. You tell me what are your problems.
So, I check every day.
Giddiness. Ani kirata?
Giddiness and headache.
Headache. Is there any weakness of hand, writing abilities affected, something like that?
Yeah, sometimes on my left arm.
कितें जाता?
Just sort of a pain comes and can't work properly, like.
Okay. If you take rest, is this your pain comes under control or it continues like that?
No. It is there. It is there.
Does he have a shock-like pain on the arms or a tingling sensation or a numbness in the arms?
ऐकलं तुवें?
Yeah. No numbness as such. There is
Nothing
no
like
numbness.
That. Okay. I think this is one of the big misconceptions in the society that spondylosis leads to giddiness and headache. And any patient who is coming with giddiness, he already has an X-ray cervical spine with him. His main complaint that he started with is headache and giddiness. And then he said there is a neck pain and sometimes he has some pain in the arm. So it's possible that he has a cervical spondylosis associated with it. He's a clerk, so he has to do a lot of writing work and all. But I think he might be having other primary headache like a migraine, which may have associated giddiness also. So I think he should consult the neurologist.
Correct. एक अतिशय गोष्ट महत्वाची आसा म्हाका दिसता मॅडम म्हणजे डॉक्टर परोलन अतिशय सुंदर गोष्ट सांगला आनी हाचे विशीं आमी एकदां आनी एका पयलींच्या कार्यावळीन भासा बसताली की खुबशे फावटी जाका आमी सर्वायकल स्पॉन्डिलोसिस म्हणटा ते चडशे फावटी अशे गिडिनेस दिनात पण कन्विनियंटली पेशंट म्हणा किंवा आय एम नॉट सेईंग की एक्युजिंग एनी पर्टिक्युलर डॉक्टर पण डॉक्टर केन्ना स्पॉन्डिलोसिस आसतले पण तशें आसतना ते खुबशे फावटी अंडरलायंग पॅथॉलॉजी कानांतल्यान जे आमचे इक्विलिब्रियम मेंटेन करतात थंय असतात आनी त्या खातीर एक ENT सर्जनाचो ओपिनियन किंवा न्युरोलॉजिस्टचो ओपिनियन खूब गरजेचो आसता आनी खुबशे फावटी थोडेशे चेंजीस जे आसता स्पॉन्डिलोसिस अशे ग्रॅज्युअल चेंजीस दे आर म्हणजे तशें शरिरान खूब कडेन चेंजीस जाताच एज द एज म्हणजे जशें 50 वर्सां उपरांत थोडेशे चेंजीस जातातूच अँड दे ऑल चेंजीस डजंट डिमांड फॉर सर्जरी this is very important. So unless and until बाबा हे पर्टिक्युलर कॉज अँड दिस इज द ओनली कॉज विच हॅज टू बी ट्रिटेड आणि त्याप्रमाणे जर तुम्ही अप्रोच दवरलो आणि डेफिनेटली आय थिंक दॅट तुम्ही तुमचं सेकंड ओपिनियन घ्या एक्सपर्ट डॉक्टरा कडेन वचून मेळात किंवा जशे ENT आसा किंवा न्युरोलॉजिस्ट आसा तांचो ओपिनियन घ्या then only if it is really required then they can go.
I would like to add to that surgery in cervical spondylosis or any kind of spondylosis is only indicated if the pain is refractory to medications. Like despite taking medications for 3-4 months, the pain is not going and it's very severe and disabling. Or there is a weakness in the limbs or some urinary or bowel problems arise. Those are the solid indications for surgery.
So जसे सांगला की डॉक्टरान की तुम्ही पहिली म्हणजे अशें मनाक लावन घेवं नाकात की आपल्याक ऑपरेशन करचें पडटलें तुम्ही सांगला त्या प्रमाणे तुमचे चडशे पॅरामिटर्स आर विथ इन द नॉर्मल रेंज एक्सेप्टेड ओके दॅट ऑल्सो इज नॉट सो फ्रिक्वेंटली सो आय थिंक मे बी दॅट थोडेशे तुम्ही एक्सरसायजीस करात थोडेशे फिजिओथेरपी जर कन्सल्ट करात आणि हातून तुमकां बरें दिसूं शकता आणि एकदम ऑपरेशनाची गरज पडटली अशें सध्या तरी दिसना बट आय थिंक अगेन वील हॅव टू इवॅल्युएट ऑन बाकीची इन्वेस्टिगेशन कशें आसा ते मॅडम लेट्स टेक अ स्मॉल ब्रेक अँड वील रिस्टार्ट